Now, more than ever, our health means everything. And when the need arises, the best healthcare facilities are closer than you think. A smooth medical journey from the Philippines to Singapore is now within reach. At the Patient Assistance Center operated by Parkway Hospitals, Singapore, patients are provided with fuss-free access to quality healthcare. Located at the ground floor of Marco Polo Hotel in Ortigas Center, Pasig City, the Patient Assistance Center serves Filipino patients and their families who need support in medical and travel arrangements. The center connects Filipino patients to the world-class medical care and offshore medical treatment of Mount Elizabeth Hospital. Mount Elizabeth Hospital has been serving the Asia-Pacific for over 40 years as a medical hub in the Asia-Pacific region. Its strategic pairing of medical talent with revolutionary medical technology paved the way for its Joint Commission International Accreditation, the Gold Seal of Approval for Quality Healthcare. The one-stop shop concierge offers services such as medical referrals and appointment booking, evacuation and repatriation assistance, flight reservation, visa application and extension, accommodation arrangement, airport meet and greet service and domestic transfer arrangement, direct admission arrangement assistance before, during, and after hospitalization, multi-language translation and interpreter service, hospital billing and financial inquiries.
Singapore is a country that has a reputation for excellence, and this includes excellence in healthcare. Hospitals and medical centers there are globally esteemed for the exemplary service and modern facilities. Among them, Parkway Hospital Singapore is a group of 4 premium hospitals, and they provide world-class, top-notch medical experience. Philippine patients can now access the services, experience, and the medical expertise of Parkway Hospital Singapore through the Parkway Patient Assistance Center, or what we call PPAC, which is located and operated in the Philippines.
For the longest time, I wanted to get an appointment to Mount Elizabeth Hospital in Singapore, but I was uncertain who would be the best specialist for my needs. I am glad I discovered the concierge services of Parkway Hospital's Patient Assistance Center to provide the necessary support I need in my travel and medical arrangements. So I went to their office in Ortigas to inquire about diagnosis and treatment options. They then scheduled a telehealth consult, an online and instant connection from here to medical experts based in Singapore. I was referred to a specialist, and they even gave me the details of the number of similar cases handled by that doctor. If you don't want to stress over the process of acquiring a healthcare service in another country, give the Patient Assistance Center a call and let them do the rest for you. The caliber of their service is truly best in class.
Choosing the best healthcare really matters. Our team at Parkway Philippines is committed to serve. We look forward to the beginning of a fruitful health-centered partnership.
Whatever your health concern may be, access the wide spectrum of medical services of Mount Elizabeth Hospital Singapore through the Patient Assistance Center. We are here for you.
Pleasant afternoon, ladies and gentlemen. Thank you so much for tuning in. On behalf of Manila Health, this is Bambina Olivares, Director of Programming, welcoming all members of Manila Health and guests of Parkway Hospital, Singapore, Philippine office. I thank you for joining this webinar themed Know Your Kidneys, Ensuring Kidney Health. Dr. James Stan's topic for today is diagnosis and treatment. In recent years, there has been an increasing incidence of renal mass present with blood urine. These renal masses are now often picked up incidentally from routine health screening. Masses could be cystic, mixed cystic solid, and solid lesions. It is important to differentiate benign or malignant, and which requires surgery and which can be managed. Angeline Go's topic for today is Healthy Kidneys for a Healthy Life. Chronic kidney disease is a common chronic health issue, usually precipitated by underlying medical conditions like diabetes, high blood pressure, and it comes with its own set of complications. If undetected and untreated, kidney failure may result. Knowing how to take care of your kidneys goes a long way in keeping you in good optimal health. Now, I am going to call on Mr. Vincent Lai, Manager for International Marketing of Parkway Hospital, Singapore, to introduce Parkway Hospital, Singapore.
Good afternoon, ladies and gentlemen. I'm Vincent from Parkway Hospital, Singapore. First, I would like to thank the team for organizing this webinar. I believe some of you have met me and heard my presentation before. COVID-19 has changed our life tremendously with social distancing and the need to wear a mask when we are in the public. It has also changed the way we work, learn and play, from attending seminar in person to joining a webinar from the comfort of your house. Parkway Hospitals owns 4 hospitals in Singapore with multidisciplinary specialty. We have a total of 36 specialties and 1,500 specialists in our hospitals. You will be able to see our specialists for simple to very complicated disease under one roof. The more complex cases we do are liver transplant, kidney transplant, and stem cell transplant. Immunotherapy for cancer treatment, using gamma knife and brain path for removing brain tumor, Urologist for prostate enlargement, robotic surgery using Da Vinci system for prostate cancer, and the latest IVL shockwave to remove hardened plaque in your artery. Those are some of the latest equipment we have in our hospitals. We are the first in Asia to have PET MRI machine, which is very useful to diagnose complex cancer and for neuro and cardio cases. And its radiation exposure to patients reduces by 70%. We also have a hybrid operating theatre equipped with advanced imaging device for minimally invasive surgery that precision is crucial. Every few years, we will consolidate our clinical quality data and compare with top institutions like Cleveland, Mayo Clinic, and Mount Sinai. We actually score better than them in terms of infection rate, surgical complications, and readmission rate. The red line is their baseline performance comparing with our 3 years data at the bottom. For your information, we have been serving more than 100,000 foreign patients outside of Singapore every year. I've introduced some of the complex cases we handled earlier. We also perform deep brain stimulation to treat Parkinson's disease. All our surgeons perform minimally invasive surgery from head to toe because of the significant benefits to our patients. Can you imagine the trauma caused by cutting open the rib cage? We do minimally invasive heart valve replacement without even opening up the chest. We install LVAD for end-stage heart failure, suitable for patients waiting for a heart transplant. For some of the critical cases whereby the patient's heart and lung fail, we will install ECMO to take over the heart and lung function first while giving treatment to them. We have this robotic assisted procedure, Makoplasty, to perform partial knee replacement. With multidisciplinary specialty under one roof, it's always a team-based approach to manage patients in critical state. All specialists are senior doctors with many years of experience in the public hospital before setting up their own clinic in the private setting. The prevalence for prostate cancer in men is very high, and robotic surgery for prostate cancer we perform is the gold standard. Mount Elizabeth Hospital is very near to Orchard MRT station and located in a prime shopping area with many hotels nearby. I'm more familiar with Novena as I stay near the area. It's also very near to the Novena MRT. Oasia Hotel is just opposite the Mount Elizabeth Novena Hospital. Grand Legas Hospital is near to the Botanic Gardens and Orchard Road, with many hotels nearby as well. We have more than 20 patient assistance centers around the region. We make appointments and direct admission for our patients, give cost estimation for surgery, arrange bed-to-bed hospital transfer from your country to Singapore, assist in insurance claims, travel arrangement, translator, and other services upon request. Last but not least, if you have further inquiries, our office manager are always here for you. Their contact details are in the webinar email sent to you. Finally, I would like to thank everyone here this afternoon and also to our expert speaker. Thank you and have a blessed day. Stay safe, stay healthy.
Thank you so much, Vincent Lai, for that very impressive presentation and for introducing our members to the very wonderful facilities, world-class facilities at Parkway. Now I'm going to call on Mr. Edwin Salonga, who is the Director of Parkway Hospital Singapore Philippine Office, who will introduce our doctor guest speakers. Edwin?
A pleasant afternoon, Director Bambina Olivares of Manila House, Parkway Hospital Singapore and Philippine team, doctors, and all attendees this afternoon. Welcome to today's webinar on the topic Know Your Kidneys, Ensuring Kidney Health. I'm Edwin Salonga, Director at Parkway Hospitals Singapore Philippine Office, and I welcome everyone to this webinar. As Parkway Hospital Singapore has already been introduced to the short video and by Mr. Vincent Lai, Manager for International Marketing, I would also like to share that Parkway Philippine Office is about opening the door for new healthcare possibilities so that you can be able to immediately access several doctor specialists from Parkway Singapore for a much needed second opinion. It is also about your having an excellent option should you or your family members decide to have an overseas medical procedure and to be able to utilize the advanced medical technologies that are already available at Parkway Hospital Singapore. Our Philippine office is located at the ground floor of the Polo Hotel in Ortigas, and our Parkway Philippines team is committed to serve. We look forward to the beginning of a fruitful health-centered partnership with you. We also wish to share some good news that early this month on March 4, vaccinated travelers from the Philippines had already been allowed entry and are now able to fly into Singapore and can now enjoy quarantine-free travel. For Philippine patients planning to go to Mount Elizabeth, Singapore, we can guide you during your application for the VTP, Vaccinated Travel Pass. You may contact any member of our Parkway Philippines team for further inquiries. At this juncture, I would now be introducing our doctor guest speakers for today. May I ask everyone to please post your questions at the Q&A box. Dr. James Tan and Dr. Angeline will do their best to address as many as they can during the Q&A session. Let me start by introducing Dr. James Tan. Dr. James Tan underwent specialist training in genitourinary cancer surgery in the London Health Sciences Center in Canada, and he attended the Chimay Foundation Medical Center in Taiwan to specialize in laparoscopic urology. Prior to starting his private practice, Dr. Tan was head of the Department of Urology at Tan Tock Seng Hospital and the lead surgeon, urology at TTSH Center for Advanced Laparoscopic Surgery. He was also the Deputy Director of TTSH Clinical Research Unit. He is currently a visiting consultant at the National University Hospital and a gazetted renal transplant surgeon in the Ministry of Health transplant team. Dr. Tan has wide experience in managing benign and malignant conditions of the adrenal gland, kidney, bladder, and prostate. He was the first in Singapore to perform laparoscopic radical prostatectomy in 2002, and he is a pioneer in procedures such as laparoscopic retroperitoneal radical nephrectomy and robotic ureteric reimplantation. Dr. James Tan has performed more than a few hundred robotic radical prostatectomies. He routinely performs bilateral nerve sparing and bladder neck sparing robotic prostatectomy to preserve potency and urinary continence. His other areas of expertise are in minimally invasive and endoscopic management of urinary stones and prostate diseases. He is in the Ministry of Health's Clinical Guideline Committee for Kidney Cancer, as well as a member of Chapter of Urology Subspecialty Committees for urologic cancers, endourology, and laparoscopy. Dr. Tan is also a member of the American Urological Association, European Urology Association, Asian Society of Endourology, Asia Pacific Society of Uro-Oncology, and Endoscopic and Laparoscopic Surgeons of Asia. Our second speaker is Dr. Angeline. Dr. Angeline is a renal medicine specialist at Mount Elizabeth Hospital, Singapore. She subspecializes in kidney transplantation. She also cares for conditions related to kidney diseases such as hypertension, diabetes mellitus, and urinary tract infections. Dr. Go has more than 20 years of experience in clinical medicine. He is well versed in the use of immunosuppressants and has spent over a decade caring for kidney transplant recipients and donors. Having cared for more than 400 prevalent kidney transplant recipients, she understands the need for regular monitoring to keep transplant recipients in good health. Prior to starting private practice, Dr. Go was a senior consultant nephrologist and transplant physician at the National University Hospital, where she was in charge of the Living Donor Kidney Transplant, LDKT program. Under her leadership, more than 100 new living donor kidney transplants have been performed in the National University Center for Organ Transplantation from 2013 up to 2019. She has developed her own program to monitor and advise patients on how to best maintain good kidney function to ensure good overall health. She strongly believes that good kidney function is a prerequisite for a healthy life. Dr. Go has been actively involved in research in kidney transplantation and has presented in regional and international conferences. He was awarded a poster of distinction at the American Transplant Congress in 2009 for her work, Survival of Second Liver Allografts. Is influenced by anti-HLA class 1 antibodies and has published her research in local and international medical journals. Let us first welcome Dr. James Tan for his presentation.
Okay, good afternoon, everybody. Thank you for the kind introduction. I'd like to thank Parkway for giving me the opportunity to speak on this subject of kidney cancer. And today we'll focus on the diagnosis and the treatment of kidney cancer. I'd like to begin by saying that kidney cancer can actually occur in any age group, beginning even in the younger 20s, 30s, but mainly in people who are more elderly, in the 60s and 70s. And there seems to be a preponderance of people, the male guys have a higher chance of having kidney cancers more than female. And those who have a history of smoking, those who are obese, people who have high blood pressure, or people who have relatives with kidney cancer also have an increased chance of having kidney cancer. To prevent kidney cancer, it is important to maintain an active lifestyle, quit smoking, and reduce weight. Now, the classical symptoms of kidney cancer includes blood in the urine, pain in the kidney area, and or maybe feeling a mass or swelling in the kidney area. Now, these are the classical triad of symptoms for kidney cancer. But quite often nowadays, patients do not present with these classical symptoms. In fact, many a times we are picking up kidney cancers without any symptoms. So how do we then pick up kidney cancer? Nowadays, more and more people are going for ultrasound of the abdomen, ultrasound of the kidneys as part of the screening program. So ultrasound is a very important and a key imaging modality nowadays in picking up renal masses. Once there's some suspicion of any kidney tumor, kidney mass, kidney cyst, that is suspicious for cancer, we will then go on to do a CT scan. Now, this CT scan, together with the contrast that we inject into the vein, will be able to show us clearly the location, the size of the tumor mass, and the likelihood of cancer. So this is an image of a CT scan showing a relatively big tumor in the upper part of the kidney. You can see the red arrow that's pointing to a tumor in the kidney. Now, quite often, patients also come and see us because they've gone for some health screening and they picked up some kind of cystic swelling in the kidneys. We call this a renal cyst. Now, renal cysts are very common and, Okay, better? Yeah. So kidney cyst is like a blister, it's like a bubble of the kidney. And the incidence increases with age. As a person gets older, more and more of these cysts will start popping up. Most of these cysts are not cancerous, but some of these cysts can be cancerous. Okay, so if you look at this picture, there is a Bosniak classification of kidney cyst. The classification of this cyst is not based on the size, but it's based on the nature of the wall of the cyst and whether there any solid substance inside the cyst. So you look at the 1 and 2. These are non-cancerous cysts. The wall are thin. The liquid inside the cyst are clear. And along the wall of the cyst, there could be some calcification. There could be some septum that's thin. There are no solid component. And most of these are non-cancerous and do not need any kind of treatment. This cyst may be as big as 10 cm, 15 cm. If patient has no symptoms, we normally leave alone. But if you look down below the type 3 and type 4 cyst, this cyst contains solid component inside that enhances, that means the color becomes, it looks brighter when the contrast is injected into the vein. Quite likely, these are cancerous. Okay, this is a CT picture of a cyst. The black color thing is a water-filled cyst, but the arrow points to a solid enhancing nodule. So very likely this could be a cancerous cyst and therefore would require surgical removal. So if you look carefully at this chart again, as I said, for type 1 and 2 cyst, irrespective of the size, we can actually leave alone and just monitor. But if it's type 3 and type 4, even though it may be very small, patient has no symptoms, maybe just 2 cm, 3 cm, we will still advise surgical removal. How we remove that, I'll talk about it later. So nowadays, we are picking up a lot of these small little kidney masses because a lot of people go for health screening, health check, and we begin to pick up a lot of these small little kidney tumor mass, and many of them are picked up incidentally, meaning they have no symptoms. Majority of these small little kidney mass are cancerous, but there are about 20% of them are non-cancerous tumor mass. We call it a benign renal tumor. So one type of benign renal tumor is this thing called renal angiomyolipoma. Quite a long name, but you look at the name itself, angiomyolipoma. There are 3 components to it. Angio means blood vessel. Myo means muscle. Lipoma means fat. So if you look at this picture here, the arrow points to that bright tumor mass. Now, some people don't call this a tumor. They call it like a form of abnormal growth. Okay? Now, the danger of this is that when it gets very big, there's a high chance of bleeding. And of course, the interest in today's lecture is that how to differentiate this from a kidney cancer. Okay, is it a kidney cancer or is it just a benign fatty abnormal growth? And that is the important thing. We need to do a CT scan or do an MRI to differentiate. Now below here, it shows a CT scan arrow showing a few of these Angiomyel lipoma. As long as they contain fat, most of the time, they are not cancerous. And some of these tumor mass can be so big, okay, it occupies almost the whole tummy. And once it bleeds, it can cause a patient to go into shock. The patient can even die from the bleeding itself. And this is not cancerous. Okay? This is not kidney cancer. It is Angiomyel lipoma. So differentiating between this and kidney cancer can be quite challenging at times. So by the time it reaches like 4 or 5 centimeters, in view of the fact that it's higher chance of bleeding, we will then remove this tumor mass. Okay, and we can remove just the Angiomyel lipoma and preserving the rest of the kidney. Again, I'll talk about the technique later on. Another form of a non-cancerous tumor mass is this thing called Oncocytoma. Okay, this tumor does not spread to the rest of the body, therefore it's not malignant. Okay, but it can grow and grow and cause compression of the kidney and the surrounding tissue. Okay. Now, so we come to this category called kidney cancer. The commonest type is clear cell renal cell carcinoma, or we call it RCC. So you look at the picture, what's encircled in the yellow circle is that tumor mass. And how do we stage kidney cancer? Okay. Kidney cancer, if it's less than 7 cm, we consider that as stage 1. Stage 2 is when the tumor is more than 7 cm, but it's still within the capsule lining of the kidney. Stage 3 is when the tumor has gone outside of the kidney capsule or extends into part of the vessel supplying the kidney. And stage 4 is when the tumor has gone to very far away place like the kidney, the lung or the bone. This is another form of kidney cancer, papillary type, slightly better prognosis. Another type of kidney cancer called chromophobe, also slightly better prognosis. Now, so when the tumor is big, what we do is that we need to remove the whole kidney tumor, including the kidney. Now, as you can tell that the kidney itself is very deep in the body. So to remove the kidney and the tumor will require a very big wound, a big incision. So for many years, the classical way of removing a kidney tumor is through a big, long incision. As you can see from here, the wound is very big. Post-op, it is very painful. Recovery will take a long time, and patient will take at least 3 months to get back to his usual activities. Nowadays, we do a lot of keyhole surgery. So these are some of the specialized instruments that we use to do keyhole surgery. It's almost like using some kind of chopstick-like kind of instruments to remove the kidney tumor. So you look at the CT scan on the left kidney, there's a tumor mass, about 6 to 7 centimeters, right? Encircled here in yellow. So again, big, long incision. But nowadays, we can do keyhole. So keyhole surgery, meaning we make a few small little opening in the tummy wall. The surgeon's hands are outside the patient. Okay, we don't put our hands into the tummy. So we'll operate, we disconnect the kidney, and then we take out the kidney tumor through a small incision at around the bladder. It's just like delivering a baby like that. So look at the CT scan. This is a scan showing a 11 centimeter tumor that is removed successfully by keyhole surgery. So nowadays we are very daring. We can actually do tumor as large as 10, 11 centimeter with keyhole surgery. Okay, of course, when the tumor is very big, like 20, 30 centimeter, it doesn't make sense to do keyhole anymore. We must well just do a traditional open surgery. Okay, but most time we like to do keyhole surgery if it's technically possible. Okay, So outcome is very good. Patient can actually go home very quickly, sometimes as fast as a 2 days stay, 3 days stay in the hospital, and patient can go back to his usual sports and daily activities very quickly. Typically, the surgery will take about maybe 2.5 to 3 hours, and patient usually will have very good outcome. So the advantage of keyhole surgery will be that of minimal pain, minimal blood loss, very short hospital stay, very quick recovery and going back to daily activities. And of course, cosmetically, it looks nicer. So nowadays, the question is to do open surgery or to do keyhole surgery? Okay, so this is a question that we often ask. Okay, but nowadays, we are asked an even more pertinent question. Can we spare the normal part of the kidney? And that's where we are right now. Okay, we're doing more and more partial nephrectomy, meaning we only take out the tumor and leaving the rest of the normal kidney behind. So you look at the CT scan here, you can see the small tumor on the right kidney as pointed by the yellow arrow. Another view of the tumor. So you look carefully, okay, the kidney average size may be about 10 to 11 centimeter. This is a 3 centimeter tumor. It doesn't make sense to make a big, long incision just to take out this small little tumor. So nowadays, we definitely will do nephron sparing. That means a partial nephrectomy. Okay. So a tumor like this can be removed successfully by partial nephrectomy. Okay, this is another view of the tumor. And nowadays, we are doing it routinely using a robotic system. We call that a robotic partial nephrectomy. So the 5 yellow arrows point to 5 small incisions. Okay, and we use a robotic system. And we've been doing this since 2005, okay, the Da Vinci robot. In fact, Maui, we just gotten our latest XI machine just 2 weeks ago. Okay. So at the start of the surgery, we put all these instruments into the tummy. The robot actually holds the surgical instrument. So the robot is like a car where you still need a good driver. Okay, it doesn't mean that you press the button and then the surgery is done by the robot. No, the robot basically works like a slave, a slave holding this specialized instrument. Whereas the master, okay, the master is the master surgeon. He will come over to the surgeon console. So it's really like driving a car. Huh? There are some hand control and also pedal, and he sits in this, immersed in this environment. And when he looks down, he can see things that are highly magnified. You can see 3D vision. And this instrument is very dexterous. It allows the surgeon to cut and to stitch. So when we do a partial nephrectomy, we position the patient, okay, by putting the patient lying sideways. And then we have to free up the colon, to separate out the kidney from the rest of the structures. We dissect the blood vessel, we control the blood vessel, and we remove only the tumor, and then we repair the defect. Now, during the surgery, we also use very high-tech like ultrasound to help us localize exactly where the tumor is, how deep the tumor is. So this got to do with operative planning and also the execution. How do we do a surgery that is so delicate, so complex in a very precise manner? So these are all technically possible nowadays. So a view of the surgery itself. So on the right hand, you can see a scissors cutting through normal kidney. Okay, we're cutting through normal kidney, and the kidney tumor is lifted up. And then at the end, we repair the defect. And we drop the specimen into a bag, and then we remove. So this picture on the left shows a tumor. So the roundish thing is actually here, is actually the tumor itself. Okay, and this part is actually the normal kidney that we remove. So we need a certain margin of safety. That means we remove the tumor plus a bit of the normal kidney. So we basically just sacrifice a little bit of the normal kidney. We preserve the bulk of the normal kidney. So this is what we call a nephron sparing partial nephrectomy, right? Now, other than surgery, nowadays, there are other alternatives to removing small renal tumor. So one of the very attractive alternative treatment is cryotherapy. So in surgery, we actually cut and remove the tumor. But in cryo, okay, the name cryo means to freeze. Okay? So we actually can put this specialized instrument into the kidney tumor and we freeze the tumor, and then we thaw the tumor, we freeze the tumor, and then we thaw the tumor. Thaw meaning we warm it up. Yeah. So the cycle of freezing and thawing creates ice crystals in the cancer cells, which will then disrupt the cells in the tumor. So this is one alternative to actual surgery. Okay, the attractive part of this is that you can do this for people who are very old, people who are frail, people whose heart is not strong enough for surgery. Okay, and this cryotherapy is done in conjunction with the radiation, the radiologist, and it can be done through the skin. Basically, we poke these sticks through the skin, we puncture into the tumor, and then we treat it. Yeah. The next alternative is that of radiofrequency ablation. So just now we talked about freezing. Now this radiofrequency is to cook the tumor. So we use heat. So again, through the skin, we use a probe, we puncture into the tumor, and then we increase the temperature, and then we cook the tumor. Now, of course, between this cryo and radiofrequency bead, whether you want to freeze it or cook it, these are alternatives to surgery. There are pros and cons. Okay, so it is best to discuss the pros and cons with the surgeons and the urologist concerned, and they will be able to advise you based on the size of the tumor, based on the location of the tumor, what is the most suitable treatment. Yeah. So I'd like to just summarize my talk by saying that nowadays kidney cancers are common. In fact, we are increasingly seeing smaller and smaller renal tumors being picked up because they have gone for some kind of health screening. So therefore, our imaging is actually the key to diagnosis. Quite often it is two-step, okay? Ultrasound screening followed by a definitive CT scan or MRI. And based on all those, we will make a decision about the best treatment strategy, be it surgery or some kind of alternative minimally invasive surgery. The best in this day and age, the gold standard is partial nephrectomy. Okay, and if the tumor is picked up early, in general, the outcome should be very good. Yeah, I'd like to end my talk here, and I'll be happy to take your questions and answer at the end. Thank you.
Thank you so much. Thank you so much, Dr. James Tan, for that presentation. Some very graphic images there, but very, very informative. And now I think we're going to turn to Dr. Angeline Go for her presentation. Dr. Go, are you ready?
Yes, I'm ready.
Good afternoon.
Good afternoon to you. Let me just start sharing my slides. Here we go. Here, our kidneys are actually a pair of bean-shaped organs located at the lower back of our bodies, roughly the size of your fist. They work to remove toxins from the body, as well as to regulate salt and water content. And our kidneys also produce hormones that are actually necessary for good bone health and for healthy bone and for red blood cell production. So what happens is that blood with waste products is brought to the kidneys, and then it's cleansed by the kidneys, and clean blood is returned to the body through the renal vein, while waste products, what's happening? Sorry, waste products with the urine is then brought to the bladder to be removed from the body. Then, how do we define chronic kidney disease? It is defined as an abnormality of kidney structure or function, which is present for at least 3 months. The estimated glomerular filtration rate can be less than 60, or there could be markers of kidney damage, including albumin in the urine. The glomerular filtration rate is actually calculated from a blood test called the serum creatinine, and we plug it into this equation that you see, a rather complicated one. You can find a formula in most websites, and we then calculate the estimated glomerular filtration rate, and it is something like the percentage kidney function. So the Kidney Disease and Improving Global Outcomes Group, or the KDIGO, have actually put the classified kidney disease into 5 different categories: 1, 2, well, there's 3A, 3B, 4, and 5, where stage 5 is kidney failure. So if anybody has a CKD stage 3 and above, which means a CKD with eGFR of less than 60, then they should be referred to a nephrologist, because they will then be at moderate to high or very high risk of future kidney failure. Now, in these 2 graphs, we see that the risk of mortality or the risk of death actually increases in chronic kidney disease. When the eGFR is less than 60, you see the risk of death actually increases. Or when there's more albumin in the urine, consistently more albumin in the urine or more protein in the urine also increases the risk of death. So chronic kidney disease is a silent killer. About 10% of the population actually have chronic kidney disease without them possibly even knowing it. Kidney disease can affect people of all ages and races. About 20% of men and 25% of women between the ages of 65 and 74 actually have chronic kidney disease, sometimes without them knowing it. The most common causes of chronic kidney disease in adults would be high blood pressure and diabetes. And unfortunately, early chronic kidney disease doesn't come with very many signs or symptoms. So a person can actually lose up to 90% of their kidney function before they experience any kind of symptoms. There is a greater increase in risk. Let me see if I can bring this down. Right. Sorry. There is an increase in risk of cardiovascular risk with kidney impairment. As you can see here, as the glomerular filtration rate falls, there's actually an increased incidence of cardiovascular events, and this can be anything like heart attack and heart failure, etc. Hang on. All right. Chronic kidney disease is also a risk factor for cardiovascular disease. This slide actually shows us the various risk factors for cardiovascular disease. And as you can see here, chronic kidney disease, as defined by an eGFR less than 60, with or without albuminuria, is also a risk factor for cardiovascular disease. In order to maintain healthy kidneys, it is important to avoid causes of acute kidney injury, because acute kidney injury actually increases the risk of new or progressive chronic kidney disease. It increases the risk of end-stage kidney disease. It increases the risk of death. And a higher stage of acute kidney injury actually puts an individual at a higher risk of future kidney disease and death. We also need to control risk factors that can potentially worsen chronic kidney disease. Therefore, regular screening, especially in people at risk, is very important to pick up chronic kidney disease and to pick up other risk factors like high blood pressure or diabetes. If you don't know you have those conditions, you kind of can't control it. But once we pick these conditions up, there is medication available in this day and age that can control these underlying conditions and help to decrease the rate of renal deterioration. early detection and treatment of kidney disease is very important in slowing its progression. Let's talk about preventing acute kidney injury. So dehydration is a very important cause of acute kidney injury. There are some months when the Philippines can get pretty hot, just like hot and humid tropical Singapore. And sometimes when we're so busy, we may forget to drink water. Well, for someone with normal kidney function, with no heart disease, it's important to drink at least 8 glasses of water daily. And if you know you're going to be out under the hot sun, walking or exercising, do increase your fluid intake. It is also important not to self-medicate. You know, we have friends, well-meaning friends and family who always tell us, oh, I took this drug I bought it from such and such a pharmacy. I got this drug from such and such a doctor. I feel very good after taking it. Well, certain drugs, especially over-the-counter painkillers, could actually harm the kidneys. So it is always best to check with your doctor before you take any medications, especially if you already have underlying chronic kidney disease. Again, before you start any new medications, if you're already taking some medicine for other underlying conditions, please check with your doctor if there will be drug interactions, because certain drugs, when taken separately, don't cause much of an issue. But certain drugs, when taken together, could actually be harmful to the kidneys and even to the liver. Some other causes of acute kidney injury include contrast-induced nephropathy. So we mentioned earlier about like the CT scans. You know, during CT scans, sometimes it is necessary to give IV contrast. For a person with normal kidney function, there is no issue whatsoever in giving IV contrast. But for someone who already has chronic kidney disease, it is best to inform your doctor that you have chronic kidney disease, and we will then see if it is suitable for you to be given IV contrast or if an alternative scan is available. Because the iodinated contrast, when given used for CT scans, can actually decrease kidney function in someone who already has advanced kidney disease. Certain infections that affect the whole body, or say recurrent urinary tract infections, can also cause acute kidney injury. And if the infection is treated promptly, the kidney injury can be easily reversed. Kidney stone disease can cause obstruction of the urinary tract, and if the urine can't come out, then that can also cause acute kidney injury. There are also certain pregnancy-associated kidney diseases that can cause acute kidney injury. And if you do have underlying kidney disease, before you get pregnant, it is best to inform your obstetrician. Crush injuries are more frequently seen these days. Strenuous physical exercises that causes muscle breakdown can also cause acute kidney injury. So if you've gone for, say, for example, a spin class, you've had bad leg pain and thigh swelling, do go for a blood test to ensure that you do not have acute kidney injury. What are some of the causes of chronic kidney disease? So chronic kidney disease means that the kidney issue must have been present for at least 3 months. We mentioned earlier that high blood pressure and diabetes are common causes of chronic kidney disease because the systemic disease can also harm the kidneys. Recurrent urinary tract infections can also affect the kidneys by causing urethric strictures or infection within the kidney itself. Kidney stones, as mentioned earlier, can obstruct the flow of urine and cause damage to the underlying kidney tissue. Some congenital kidney diseases, like polycystic kidney disease, it's actually a condition whereby a patient has multiple cysts in the kidneys, and these cysts eat away at the normal kidney tissue, causing the kidney to eventually fail. Glomerular nephritis is a condition whereby there's inflammation of the kidneys, and prolonged inflammation, if left untreated, eventually leads to renal scarring and end-stage kidney failure. Someone who is obese can actually cause a lot of stress to their own kidneys because the kidney cannot deal with the metabolic load as required by the body. And this again can give rise to long-term chronic kidney disease. It is important to identify and control risk factors for chronic kidney disease. Let's begin by looking at diabetes. For patients who have diabetes, your doctor would usually check this blood reading called the HbA1c that tells you your overall diabetes control for the past 3 months. If you're below the age of 75, you aim to keep your HbA1c or your 3-month blood sugar about 6.5 to 7%. If you're above 75, we aim for a HbA1c of less than or equal to 7.5%. As the prevalence of diabetes is increasing with increasing age, regular health screening to pick up diabetes is very important so that you can control it. High blood pressure. Again, it is very important to control blood pressure so that the kidneys don't get too stressed when faced with a persistent high blood pressure. So for patients who already have a raised serum creatinine but do not have protein or albumin in the urine, we aim for a blood pressure of less than or equal to 140/90. For those who already have protein in the urine, which is defined as greater than or equal to 30 milligrams of albumin per day, we aim for a blood pressure of less than or equal to 130. Kidney disease and blood pressure are very closely linked conditions. Kidney disease can cause high blood pressure. High blood pressure can also cause kidney disease. So again, it is very important to screen for both. And it is very easy nowadays to just walk into a pharmacy and buy a blood pressure monitor. If your blood pressure reading is consistently above 140/90, do see your doctor and get a blood test and urine test to check your kidney function. Now, what are some of the other things we can do to ensure that we do not get chronic kidney disease? Or if we already have chronic kidney disease, to ensure that the kidney function doesn't deteriorate so quickly? Adhering to a healthy diet is one of the first things we can do. So a low salt diet really helps to control blood pressure. A lot of patients tell me, I don't add salt in my cooking at all. But if you don't add pure salt and you add a lot of these condiments that we use in Asian cooking, that is almost the equivalent of adding salt to your cooking. It is really not too difficult to decrease salt intake. So for those of us who do cook, for example, if you use certain kind of sauces, say oyster sauce to cook, instead of pouring 3 times into the wok, for example, you can pour twice or just once. And that would already be a reduction in salt. A diet that's rich in whole grains, fruits, and vegetables is also very, very important for good cardiovascular as well as good kidney health. If you already have chronic kidney disease, it would be good to lower your protein intake to about 0.8 grams of protein per kilogram of your body weight per day. So in general, someone with stage 3B or stage 4 chronic kidney disease, I'd tell them to eat about palm size and palm thickness of protein a day, whether it's fish, chicken, or meat. And that's per day, not per meal. The next thing is that if you do have chronic kidney disease, instead of taking 8 glasses of water daily, you may have to restrict your diet because the kidneys may not be able to deal with a 2-liter fluid intake. So check with your doctor to see how much fluids you should be taking if you already have underlying chronic kidney disease. Adhering to a healthy lifestyle is also very important for good cardiovascular as well as good kidney health. So stop smoking. There's no such thing as healthy smoking or reduced smoking that's good for health. Even 1 puff is bad. If you're a smoker, do stop. It's not good for your blood vessels, and it's not good for your heart. It's not good for your kidneys. Alcohol consumption should be limited to 1 to 2 drinks per day in men and about 1 drink in women. Physical activity compatible with good cardiovascular health is very important. It also depends on your own physical tolerance. So if you're not the most active person to begin with, do start slow and slowly build up your exercise program. In general, we would recommend kidney exercise of up to about 150 minutes 5 times per week. Achieving a healthy weight is also very important. So a healthy lifestyle and healthy diet would help achieve a healthy weight of a BMI about 20 to 25. Okay, so I think something went wrong with my animation here. Sorry. So it is important to identify complications of chronic kidney disease if you do have chronic kidney disease. Our kidneys help to buffer acid. So if you check a blood test, we find this bicarbonate is less than 22, we can actually give you some medication to correct that. In chronic kidney disease, there's also mineral and bone disorders. We need to check serum calcium, phosphate, parathyroid hormone levels, and we can give you medication to correct that again. I mentioned earlier that your kidneys actually produce hormones necessary for red cell production. So in chronic kidney disease, patients could also get anemia, and again, that can be treated with medications, oral medications, and injections. In general, we aim for a hemoglobin of more than 12 in women and more than 13 in men. Now, chronic kidney disease, especially advanced kidney disease, stage 4 and above, is actually an immunocompromising or immunosuppressing condition. Therefore, patients with advanced chronic kidney disease should get themselves vaccinated with the most up-to-date vaccines. These include your annual influenza vaccine, the pneumococcal vaccine, which is 2 doses given about 8 weeks apart, hepatitis B vaccine, especially in those at high risk of progression of chronic kidney disease. And in this day and age, the COVID vaccine is definitely something very, very important. What actually happens in kidney failure? Well, if we see that a normal kidney works to remove waste products, regulate salt and fluid balance, and they produce hormones that regulate blood pressure, blood production, and bone growth. So in initial early stage kidney disease, there could just be some nausea, some itch, just feeling tired with a loss of appetite, all very non-specific symptoms. Later on, as the kidney cannot remove the extra water from the body, you could get leg swelling or even swelling around the eyes when we wake up early in the morning. There could be anemia as the kidneys stop producing sufficient hormones for red blood cell production. There could be high blood pressure and weak bones. Again, because the symptoms of kidney disease are very non-specific in early advanced kidney disease, we do not want to wait till the blood pressure is so high or when there's leg swelling or anemia before this is picked up. So regular and early screening, early detection is very important here. So early identification of kidney disease involves blood pressure checks. Even doing a simple urine dipstick test to look for blood and protein in the urine will help. You can look out for chalky urine, which is a sign of having blood in the urine, or frothy urine, which is a sign of having protein in the urine. If you have any of these, do see your doctor to get a formal blood test and urine test to check your kidney function. In terms of self-care, try to adhere to a healthy diet and a healthy lifestyle. Avoid taking over-the-counter anti-inflammatory or painkillers. Do take medications as prescribed by your doctor and not as recommended by your friends. Do keep your follow-up appointments with your doctor. And if you have diabetes, high blood pressure, if you're on the bigger side, if your BMI is more than 25, or if you have a family history of kidney disease, do get your kidney function checked through regular blood and urine tests. If you have a loved one, a family member who has chronic kidney disease, do remember that it can be a result of other medical problems. Encourage them to have a healthy diet and healthy lifestyle, and even better, be a part of that healthy diet and healthy lifestyle. You know, the whole family changes the meal plans together. The whole family goes for an exercise together. That would really perk them up and let them feel that they're not alone in having chronic kidney disease. Try to accompany your loved ones for their medical appointments to see what the doctor has to say, and offer emotional support and a listening ear. My take-home message would be that chronic kidney disease can be treated and its progression can be slowed down with good control of risk factors. You can live long and well with chronic kidney disease. In this day and age, medicine is so advanced, there are many treatment options which we can offer to our CKD patients if you seek treatment early. Thank you very much, and I'll be happy to take any questions that you may have.
Thank you so much, Dr. Go. That was it's quite a lot to digest actually between the two, between Dr. James Tan and Dr. Angeline Go. Very practical advice as well from Dr. Go as to how to deal with chronic kidney disease. I'd like to bring in now Ms. Dorothy Aquino, who is the manager of Parkway Hospital Singapore Philippine office, who will facilitate the Q&A segment of today's program with our distinguished doctor guests. The Q&A box actually has been blowing up for quite some time with lots of questions. And so we're gonna get to it right away. Dorothy, can I turn over to you?
Yes, thank you so much, Director Bambina. Again, thank you so much, Dr. James Tan and Dr. Angeline Go, for that very informative lecture. And again, good afternoon, everyone. All right, so without further ado, we'll proceed to the first question, and this is for Dr. James Tan. Dr. Tan, what is the life expectancy for those ages 58 and above who undergone right nephrectomy with findings or stage 2, grade 2 cancer?
Okay, so for kidney cancers, actually it's one of the better cancers to have. Because for many cancers, we look at the 5-year survival, like stomach cancer, pancreatic cancer. We always look at 5-year survival. How many of the patients are still left alive at the end of 5 years, right? So for kidney cancer, we have 5-year survival, but we also have 10-year survival statistics, which means that many of them will live beyond 5 years, and many of them will live even beyond 10 years. So for example, in stage 1 kidney cancer, the 5-year survival is 90 to 93% 5-year survival for stage 1. Stage 2, it drops a little bit, maybe about just under 90%. But when we talk about 10-year survival, it's also very good for stage 1. Again, around 90%. Stage 2 maybe drop to about 80, 85%. Still very good. So I would say that to answer your question, specifically stage 2 kidney cancer survival 5 years is about 85 to 90%.
Yeah, thank you so much. That's a very good news. And I think this is for Dr. Angeline Go. Dr. Go, how to be certain what tests need to be done to diagnose correctly renal TB or tuberculosis? What is the best treatment for renal TB with least side effects? Does this recur? Will one have renal TB even if if the previous kidney cyst, which was said to be a sign of TB, is gone?
Right. Renal tuberculosis is not that uncommon in Southeast Asia, but it tends to have, it's what we call an extra pulmonary cause of tuberculosis. So tuberculosis usually tends to happen in the lungs. It is possible to have purely tuberculosis in the genitourinary tract, which means in the kidneys, in the ureter, or in the bladder, but that's not so common. Probably only 20% of patients have that. It is usually patients don't have very much symptoms alone if it's just genitourinary tract TB. They can present with the usual fever, chills, night sweats, or they can just have some blood in the urine or just some milky urine, or they can have persistent white blood cells in the urine and the urine culture just comes back negative. Now, in such cases, we can send the urine for special TB culture, but that takes about 6 weeks to come back. There are also some TB PCR tests we can do in the blood, and sometimes that may come back positive or that may come back negative. We do have the PCR test that can also be done for the urine, and that really is to see if we can pick up the bacteria, Mycobacterium tuberculosis, that causes renal TB in the urine or not. If we can pick that up, then yes, we will have to treat as for usual tuberculosis, and that usually involves 4 different drugs for a duration of at least 6 to 9 months under very close monitoring. So tuberculosis can recur, definitely. Once there's a nidus in the body, it can easily recur, and you will need long-term follow-up either with your kidney specialist or with your infectious disease doctor for that.
All right. Thank you so much, Dr. Go. For Dr. Tan, having been said that the prognosis for the kidney cancer is generally good if it picked up early, right? So can you share with us the early signs of a kidney cancer so we can be able to prevent it or have it checked in advance?
Actually, there are no early signs. In fact, many of these kidney cancers have no symptoms at the start. many of the kidney cancers are picked up incidentally. But of course, sometimes, they have some blood in the urine that can be picked up in a routine urine test. So anybody with blood in the urine should go for some kind of evaluation. Do not just treat it like a UTI, because some of these may harbor something more serious like a tumor. So these are signs that, okay, maybe you need further investigation. So depending on the situation, this person may need an ultrasound, scan a kidney, or maybe even go on to do a CT scan. So to rely on symptoms alone may not be very good, because there are, many of these kidney tumors at the start have no symptoms.
All right. Okay, so I think this is for Dr. Go. What is the significance of the cystatin C test, especially when both BU and creatinine and urinalysis are normal?
Cystatin C is a biomarker. That means it's something you can use to measure and then plug into an equation to measure your estimated glomerular filtration rate. So in a regular blood test, we check creatinine, which is also another biomarker. It's just if you use both creatinine and cystatin C, you may get a more accurate measurement of your glomerular filtration rate.
Okay. I think this one anyone can answer, doctors, no? So what are the tests that should be done on a yearly basis in order to check on the kidney aside from CT scan?
Okay, maybe I'll do the kidney function bit and then Dr. Tan can talk about the cancer bit. For kidney function, number one, check your blood pressure. Go to any pharmacy, buy a blood pressure monitor, check your blood pressure. Number two, check your sugar at least once, your blood sugar at least once a year. Check your kidney function at least once a year if you do not already have chronic kidney disease. And just do a urine dipstick test that can tell you whether you have blood or protein in the urine. If you have any of those, then you should see your doctor and we can then advise on what tests are needed if you do already have underlying kidney disease.
All right, thank you so much, Dr. Go. For Dr. Tan, if does a person need to change their diet after being diagnosed with kidney cancer?
No, not really. Just take healthy, balanced diet. Make sure you're not overweight. Make sure no high blood pressure. Like what Dr. Angeline has spoken earlier on, reduce salt, because you only have maybe part of the kidney is already removed. And especially if you have one whole kidney removed, you have the other kidney left. So you do not want to overload the only kidney left. You need to watch your sugar level, your blood pressure level. So basically, it's just healthy lifestyle, active living, exercise regularly, prevent overweight. Yeah.
All right, thank you so much, Dr. Tan. Dr. Goder, we have a question here about drinking coffee and drinking wine also. Is drinking coffee affect your kidney and drinking wine is good?
Okay, drinking wine first, some people say it's good for the heart, but there are no studies done for the kidney. Coffee per se, there are no studies done for the kidney, but I would say that we know that coffee is a very mild diuretic. So if you're going to be drinking like 8 cups of coffee a day, then you may become dehydrated in the process. But if you're just drinking the regular about 2 or 3 cups a day, it shouldn't affect your kidney function at all. I can't say it's good for the kidneys, but it wouldn't cause your kidney function to get worse.
All right. So let me check. Okay. So we have another question here from Mr. Dantag. Regarding diet, does being a vegetarian help prevent kidney disease? How about, you answered this already, how about regular coffee intake? So about being vegetarian, does it help prevent kidney disease?
Not that I know of. We have some patients who are vegetarian who also get kidney disease. I think the important thing is not to have a high salt diet and not to protein load too much, rather than between vegetable and animal protein. There are some studies to show that if you take more vegetable protein rather than more animal protein, it may help prevent the rate of deterioration of kidney function if you already do have underlying kidney disease. But there are no studies done between vegetarians and non-vegetarians to show who actually has a higher incidence of kidney disease.
Okay. So, all right. So I think another question for Dr. Go. Okay, let me see. What food to avoid in glomerulonephritis and how can we prevent it to become CKD? Is taking up keto analogs will help the kidney?
Glomerulonephritis is actually an inflammation of the kidney. So if it really causes you to have underlying chronic kidney disease, then it's back to the usual preventive measures: healthy diet, low salt, not to protein load too much, as well as regular exercise. Keto analogs are basically, if you think about it, it's something like a pre-digested protein that's put into a tablet. So when we take in a lot of protein in the diet, the waste products of protein have to be removed by the kidneys. If you have normal kidney function, that's fine. Your kidneys can deal with it. But if you already have underlying chronic kidney disease and you were to take a lot of protein, then you're going to cause your protein to become, your kidneys to become quite overworked. So in such cases, instead of taking the protein in terms of, say, the meat, the fish, the chicken, you can take the keto analogs instead to help supplement your amino acid intake.
All right, thank you, Dr. Go. Another one from Mr. Robert Christopher Ong. Which is better or more acceptable to calculate EGFR, Doc? Is it Cockcroft, GOLD, or CKD-EPI?
Since 2012, we've been using the CKD-EPI equation. It's actually been the one that's recommended, not Cockcroft GOLD. Though the earlier studies for all the drugs were with Cockcroft GOLD, CKD-EPI equation is actually the one that's recommended now.
All right. Okay. So, all right. Anyone can answer this maybe. Is protein in the urine can be prevented? Is Blumea balsamifera advisable to take if you have glomerulonephritis?
Sorry, can you answer that again? Kind of missed the question.
Is protein in the urine can be prevented? Is Blumea balsamifera advisable to take if you have glomerulonephritis?
Okay, so protein in the urine is one of the first signs of kidney stress. Usually if we were to check the urine and we find that there's protein, then we can give you some medications to reduce the amount of protein in the urine. With regards to the Blumea, I'm not sure what that is.
Okay. I think we have answered all the questions here. Let me just double check, doctors.
Can I see some other questions? Sorry, let me just come in.
Yes, please.
Dr. Go, you mentioned something about high blood pressure affecting the kidneys and vice versa. Now, are there any medications like statins or, or if you have cardiovascular disease or something, how do they affect your kidney functions? Is there anything you can take to counteract like statins or blood pressure medicine that you're taking?
Right. Okay, most drugs that are good for the heart is good for the kidneys. So if you saw that, everything that we talked about earlier, the healthy diet, healthy lifestyle, they're all good for the heart. And so they're all good for the kidneys. So in general, whatever drugs a cardiologist or a heart specialist would give to any patient, they would tend to be drugs that are already going to help the kidneys anyway, because by improving the cardiac health, it will help the kidneys. But it's just that in terms of kidneys, there are some medication that we prefer because it can also at the same time help to reduce protein in the urine. So this will be the group of the angiotensin receptor blockers. That will be our first line go-to drugs for someone with high blood pressure who also has protein in the urine. Statins are proven to help people reduce cholesterol more than anything else. So if they already have high cholesterol, it would be good to be on a statin just to reduce the amount of reduce the cholesterol, and that again helps in good cardiovascular health and therefore protects the kidneys.
Okay, so there's no they kind of complement each other. So
there's no one particular drug that's just good for the kidneys per se.
Yeah. What about other kinds of supplements like vitamins and supplements? Because, the supplement, like some doctors will prescribe, obviously, if you have certain nutritional deficiencies or something, then they'll say, like, there was a question here about alpha lipoic acid or NAC, things like that. Do they affect kidney function in any way?
Okay, the alpha lipoic acid is actually an antioxidant. There are some studies done in rats, nothing in humans yet, but if it's an antioxidant, it shouldn't harm the kidney as long as they take it in the recommended amounts.
Okay. Dorothy, do you see any more questions? I think
I can ask this to maybe Dr. Tan. What procedure, Dr. Tan, can you recommend for 2 cm renal stone?
Okay, so we're talking about stone now, kidney stone. So 2 cm is not that small, nor is it very big. So we can do traditionally 2 centimeter, we do a percutaneous nephrolithotripsy. That means we make a small little puncture through the skin directly into the kidney, and then we put a telescope into the kidney. We see the stone, we use a special machine to grind the stone and suck out the stone fragment. So this is what we can do. Alternative will be we put a flexible scope through the urine tract, through the bladder, through the ureter, all the way up into the kidney. And then we use a laser to fragment the stone. And then we use some kind of basket, stone basket, to drag the stone fragments out. So it is getting more and more popular because it is less invasive. The risk of major bleeding is much less. So 2 centimeter stone, we nowadays don't do shock wave. Shock wave would mean that we basically blast the stone into fragments and then wait for the fragments to pass. But for 2 centimeter, it is really too big for shock wave treatment. I would not recommend that. So either percutaneous surgery or laser through the urine tract itself.
All right, thank you
Dr.
so
Tan,
much.
can I ask, I just wanted to ask also about kidney cancer. For example, a survivor of kidney cancer now for several years. I guess maybe through just regular life or something has put extra pressure on his kidneys and all that. And suddenly now after maybe being in remission for 10 years, needs dialysis on a regular basis. Would that be like a kind of life sentence in the sense that once you start dialysis, you don't stop for the rest of your life or until you get a transplant, perhaps? How does that work?
Yeah, okay, maybe let me explain. So usually when we when there's a kidney cancer, usually it happens in one of the kidney. So even we take out one kidney, you have the other kidney that's normal. So you should not end up being in kidney failure and requiring kidney transplant or dialysis. Now, if there is a need for dialysis, it means that this kidney also have another kidney tumor that needs to be removed. Or more commonly, you'll be a background of chronic diabetes and high blood pressure.
Yeah.
So therefore, once a kidney is removed, the remaining kidney, you really have to treat it in a precious manner. Okay, you have to watch your lifestyle. Earlier, I think I forgot to mention one very important point, and that is these kidney cancers are quite often, in fact, most often, it is due to some genetic mutation. So once you are found to have a kidney tumor, you have a 4%, okay, 4% lifetime risk of having some more kidney tumors in the remaining kidney. So that means you can have a tumor on the right side. As you follow up, you may develop another kidney tumor on the left side. Or let's say you do a partial nephrectomy. Let's say you remove the tumor on the then the leftover kidney also have a risk of having another tumor. So I have a patient, in fact, I have 2 patients who had a kidney tumor removed, and then 3 to 4 years later, they develop another tumor. Now, I've also seen cases where they had one whole kidney removed, and then they develop a new tumor on the other side. So we do a partial, and then they develop another tumor in the remaining kidney. So basically, it's like you remove one kidney, this other kidney, you remove one third, and you left really maybe like half of the kidney on one side, still surviving without the need for dialysis. It's possible. Yeah, so I think to answer your question completely, once kidney failure sets in, then they have to see the renal physician and then they have to manage. Then we'll ask doctor go to come in.
Thank you, doctor.
All right.
Yes,
I think Sir Edwin, yes, Ms. Bambina, I think Sir Edwin wants to say something, or you have a question, Sir Edwin? All right. Okay. So I think that was all. Anyway, for those who still have questions and to our dear doctors here, you can just email it to us. Send an email to manila.ph@ihhhealthcare.com, and we will try to forward it to our dear doctors here and revert to you for their answers. All right. Thank you so much, Dr. Go and Dr. Tan. Again, thank you for sharing your expertise.
Thank you.
And,
yes, thank you.
Thank
Thank
you for
you.
sharing your
Today's session has
expertise.
come. Yes, thank you for joining us today. It's been a very, very informative session. And we hope that we've been able to help you with your questions about chronic kidney disease and kidney cancer. And please do not hesitate to reach out to Manila House or to Parkway hospitals for any questions. So we wish you all good health and functioning kidneys. Thank you.
Thank you.